Hey, I'm Jessica. I've done a couple videos, I think like 3 videos on borderline personality disorder, also known as BPD, talking about different aspects of it, of what people who have BPD go through and what people who don't have BPD but know someone who has BPD, what they go through. Um, I guess in some ways this was like kind of a test to see how my point of view on things and hear myself actually say it out loud. But also, I do hope that if anybody watches these, that they're beneficial in helping you understand BPD a little more. So today the topic I'm specifically going to hit on is medications. This is going to be a pretty short video, but a lot of people who have BPD are on medications. You know, we have medications for antidepressants, anti-anxiety medication, mood stabilizing medication. So far, these things you've probably heard of. They might sound kind of weird, but it's just sometimes medication is needed when part of your brain doesn't work a certain way and certain aspects of life are a little hard. Just like how I'm not going to compare this like BPD is you're defective or anything, but if you have a heart defect, if that's just part of who you are, you need to take medication in order to function normally and in a way where you're comfortable. People who have personality disorders have to take medication in order to be able to, enjoy life, and that's okay. So taking medications is very common. The important thing is to stay on your medication. You know, there are parts of being, having BPD where life feels absolutely awesome. And sometimes that may be short-lived. That might be a short-lived feeling. Sometimes it could be a prolonged feeling, for days or weeks. You are just beginning to feel like you have your ups and downs, but for the most part, you have control of things. And then some people decide, okay, I'm fixed, I'm cured, I must not need my medication anymore. This is really bad. People in therapy who have BPD, the most common returning people, I don't want to say the most common returning people. I don't want to say that at all because that's not true. But it's very common that people have to get back into an intensive therapy routine because they've stopped their medication and they're not regulated. So basically, long story short with all this, medication, totally common, totally okay, not something to judge yourself about, not something to judge someone else about, good stuff comes from it. However, no matter what you're feeling, good, bad, whatever, do not stop your medication and do not change your medication without talking to a doctor first. It may feel like a good idea at the time, but it's really not. Anyone who knows someone with BPD, it can be really insulting to hear the question, are you on your medication? Because most times when people ask that, the person with BPD, I don't want to say most times, but a good bit of the time, they're on their medication, but they're having an issue and they're having a hard time working through it. So by you asking, are you on your medication, can be really taken as an insult. As just kind of, wow, thanks for that slap. But if you know someone with BPD and you are able to really kind of pay attention to how they are on medicine, off medicine, if they've admitted to you that they've changed their medication before talking to their doctor, I would just say help people make sure they're staying on their medication. That's not your responsibility. That's our own responsibility, but medication's a big deal. It's okay, just don't mess with it without your doctor. Have your doctor be the one to change anything, and you do everything as prescribed. and then be sure to talk to your doctor about any side effects you're feeling. Anyone who knows someone with BPD, if you see that they've had a change in medication and they have a weird side effect happening that they might not realize, make sure to let them know. Doctors need to know these things in order to make sure you're on the right combination of medication. So otherwise, hope that was helpful, and I hope you continue watching my videos. Thanks.